Watch this dog exploring the environment nose first. It is a completely normal canine behavior, but it also serves as a highly efficient vector for picking up invisible pathogens from the ground. When a dog ingests microscopic amounts of contaminated saliva, urine, or feces left by another animal, they can introduce a pathogen known as Canine Adenovirus, or CAV, directly into their system. This 3D rendering shows the structure of that threat. Canine adenovirus is a non-enveloped DNA virus. Because it lacks a fragile lipid envelope, its durable, geometric outer shell allows it to survive for months in the outside environment, even in freezing temperatures. A virus that can survive for months on a sidewalk or a patch of grass makes environmental transmission nearly impossible to prevent. Dogs will inevitably encounter it simply by interacting with their surroundings. In the wild, this virus exists as two distinct genetically related serotypes. Let's look at the milder strain first, CAV-2. Look closely at the nasal discharge on this dog's snout. This is the hallmark of CAV-2. It primarily restricts itself to the respiratory tract, causing a localized infection commonly known as kennel cough. Its twin, CAV-1, is the agent behind infectious canine hepatitis. Despite the similar name, CAV-1 bypasses the lungs and launches a fatal systemic attack on the entire body. An infection with CAV-1 triggers a chaotic cascade of symptoms: a sudden spike in fever, severe abdominal pain, jaundice, uncontrollable internal bleeding, and rapid multi-organ failure. One variant remains a localized cough, while its nearly identical twin possesses the mechanical ability to dismantle multiple internal organs simultaneously. This anatomical cross-section illustrates CAV-1's entry. After ingestion, the virus multiplies in the tonsillar crypts and intestinal Peyer's patches. Within days, it breaches local lymph tissues, flooding the bloodstream, a phase called viremia. Zooming in shows the virus striking its true target, vascular endothelial cells. Vascular endothelial cells are the delicate, flat cells lining the inside of every blood vessel. They maintain the structural integrity of our veins and arteries. By binding to and destroying these cells, the virus collapses the body's entire delivery system. It turns the bloodstream itself into the mechanism for total systemic failure. Because the liver acts as the body's primary blood filtration engine, it receives the brunt of this vascular destruction first. Looking at this pathology image, you can see the direct result of hepatocellular necrosis. The infected liver cells die off rapidly, causing the liver itself to become engorged and mottled, while the wall of the gallbladder becomes severely thickened with fluid. As the liver fails, a secondary, highly lethal problem emerges. The liver abruptly stops producing vital blood clotting factors. Without clotting factors to plug the gaps in the already damaged, leaky blood vessels, the dog begins to bleed uncontrollably into its own tissues and abdominal cavity. This slide details the next target. The virus moves directly into the kidneys, replicating inside the endothelial cells of the renal glomeruli, the microscopic tufts of capillaries that filter urine. This localized renal damage triggers massive spikes in kidney enzymes and causes pinpoint hemorrhages across the outer cortex of the kidney. Simultaneously, compromised vascular integrity causes sudden microhemorrhages in the brainstem and forebrain, triggering intermittent seizures, bouts of ataxia, and eventual paralysis. CAV-1 induces multi-organ failure by systematically destroying the blood supply. It simultaneously starves and floods every vital organ until the system simply gives out. If a dog manages to survive the acute bleeding and organ failure, the virus leaves a damaging immunological legacy weeks after recovery. Look at the main portrait here. This severe, cloudy appearance of the cornea is a clinical sign known as blue eye. Blue eye is the result of late-stage immune complex reactions. Even though the virus is clearing, the dog's own immune system overreacts, causing massive inflammation in the cornea and the uvea of the eye. And the danger extends beyond the individual dog. Out here, recovered dogs silently shed live virus in their urine for over 6 months. Look at this wild red fox. Prolonged viral shedding maintains the disease in the wild, posing a constant, unseen threat to susceptible feral hosts like foxes, wolves, and coyotes. Surviving the initial illness is only half the battle. The long-term shedding ensures the virus remains a persistent threat to entire canid populations. This leaves veterinary science with a difficult challenge: How do you safely immunize an animal against a virus that explicitly targets and destroys the vascular system? This vintage photograph captures the eventual solution. Veterinarians used the mild respiratory strain, CAV-2, as a decoy to build immunity against the deadly CAV-1. Because the two strains are so genetically similar, exposing a dog's immune system to the respiratory variant teaches it to recognize and neutralize the systemic variant as well. This split-screen diagram highlights the crucial safety feature. While CAV-1 rapidly invades the bloodstream on the left, the CAV-2 vaccine on the right is physically incapable of replicating systemically or attacking endothelial cells. It remains confined entirely to the respiratory tract. Historically, early vaccines that used live attenuated CAV-1 carried the risk of triggering blue eye in patients. The CAV-2 decoy vaccine eliminated that risk completely. By napping the precise cellular targets of these twin viruses, researchers were able to take a highly contagious respiratory bug and turn it into a biological shield against one of the most devastating systemic diseases in dogs.